Hi, good afternoon, everyone. This is Jason Jones from the Community Technical Assistance Center of New York. Thank you so much for joining us for this webinar. Before we get started, I just wanted to run through a few things concerning the CEUs. So for anyone that is taking this for continuing education unit credits, you will have to log on via the webinar system via your computer. And you'll need to go to the School of Social Work's site to create a profile, select today's webinar, pay the $15 processing fee, and then take the knowledge test. The knowledge test will be given to you within 24 hours via email. So you will receive an email after this with all of this information. I just wanted to run through it now before we get started. Hi, everyone. Good afternoon again. This is Jason Jones from the Community Technical Assistance Center of New York, and we are pleased to announce and have you join us for Microaggressions and the Therapeutic Alliance in Ethnically and Racially Diverse Therapist-Client Dyads. So we are joined by Dr. Monica Williams, the Director of the Center of Mental Health Disparities from the University of Louisville, and we are just going to let her introduce herself as well as the topic. Thank you for joining us, and we hope you enjoy it. Dr. Williams?
Yes, hello, thank you. It's wonderful to be here. And I'm also very excited that so many of you are interested in this topic. It's a really important topic, and microaggressions can play a huge role in the Therapeutic Alliance, and we're going to learn about that today. So first, a little bit about myself. This is me here. Ooh. With some of my wonderful students at a conference. I am, as Jason mentioned, the director of the Center for Mental Health Disparities and an associate professor in psychological and brain sciences at the University of Louisville. I'm also the clinical director of the Behavioral Wellness Counseling Clinic, which is primarily a training clinic for my wonderful students. And I am licensed in the state of Pennsylvania and Kentucky as a clinical psychologist. And I do a lot of research, so I wear a lot of different hats, and one thing that I've always had a passion about is mental health disparities, and when clinicians don't know how to interact with people who are different, that creates a mental health disparity, and so that's why I love to teach about this sort of material. Okay, so before we get started, I have to warn you, this presentation may make you uncomfortable. There are many stereotypes about different ethnic and racial groups, and we are socialized not to talk about racial issues. And part of the reason people don't talk about racial issues is because often they're afraid of being perceived as racist. And we are going to talk about all of this, and you may be uncomfortable at times. That's okay. That's why I may try to make you laugh, and I may include some amusing memes as part of the presentation. This is my cool dad meme where he says, "I won't have my daughter bringing a black man into this house until I've had time to buy Afrocentric art for the foyer." What an awesome dad, yeah? Wish that had been my dad. Anyway, some of you will still be uncomfortable, and that's okay. You're just going to tolerate the discomfort. Okay. And because this is sensitive topic matter, all audiences, public, undergrads, graduate students, medical students, and even professionals in psychology and medicine have said that this can be difficult sometimes. So I want you to know that I'm making the following assumptions about you, and trust me, they're all good assumptions. The first assumption is that if you experience discomfort during this talk, it's because you're in one or more of the following groups: caring, empathetic, least likely to offend others, and you want to avoid causing harm. Or maybe some of these things have happened to you and you've been exposed to racism either personally or in your environment. And furthermore, you're here because you care about others, you care about your clients or patients or research subjects and you want to do even better. And that's a great reason to be here. So, so we are going to go forward with those considerations in mind. All right. So before we move on to microaggressions, the heart of this discussion, it's really important to understand stereotypes. Because a lot of times microaggressions are based or rooted in stereotypes. And so, so we're going to spend a few minutes talking about that. What are stereotypes, right? Stereotypes are beliefs that all people within a particular group possess the same traits or characteristics. And maybe you can think of some examples of stereotypes. I can tell you I live in Kentucky now. I have never lived in this part of the country before. I'm originally from California, and I've also lived in many places on the East Coast. And I got to tell you, if someone had told me 5 years ago I was going to be living in Kentucky, I would have said, no, I don't think so. But I have to be honest, I had some stereotypes about what people in Kentucky were like. And when I came here to Louisville, I looked around and it seemed like everybody, they all had all of their teeth and they wore shoes, and I didn't see any major appliances on the porch. So I thought, I guess my stereotypes about Kentucky are not true. And just in case you're wondering, these two gentlemen in the pictures are not Kentuckians. They are my relatives in Canada. So you may even have some stereotypes about what Canadians are like, eh? And I guarantee you, your stereotypes are not always right. Okay, so in addition to stereotypes about Kentuckians, there's even stereotypes about psychologists. And this is something that's near and dear to my heart because I am a psychologist. And also people have all sorts of thoughts about psychologists. I always find it amusing when people say, "Oh, are you reading my mind?" And I say, it's not a perfect science, but yes, I am reading your mind. Anyway, sometimes stereotypes can be considered more fun than harmful. But if you think about it for a minute, when can stereotypes cause harm? So there is a type of stereotype that I refer to as a pathological stereotype because it really actually has nothing to do with the characteristics of the stereotyped individuals. And I want you to think about stereotypes that you may have been exposed to about different groups like women or Asian Americans or Hispanic people or even Black people. So stereotypes are defined as false or incorrect ideas attributed to particular members of a group based on illogical reasoning, and they represent unfair generalizations that don't change when presented with accurate information. And so that's really important to understand, even though we may not want to, even though stereotypes may not be true, when someone shows you information that makes you question your stereotype, we still tend to cling on to those stereotypes. And pathological stereotypes take that a step further because these are about people and their means of explaining and justifying differences between groups and then using those differences to oppress the out-group, right? So it's really important to understand that social status or group position determines the stereotype content, not the actual characteristics of the group members. And what you tend to see is that groups that enjoy fewer social and economic advantages will be stereotyped in a way that helps explain the disparities, such as lower employment rates. For example, although disadvantaged group members may have greater difficulties finding a job due to in-group favoritism or racism or related social forces, the disadvantaged group member is unjustifiably characterized as unmotivated. In other words, he could find a job if he looked hard enough, or unintelligent, like maybe he's not smart enough to have that job, or even lazy, like he'd rather take handouts than work. And evidence of this is seen in the negative terms that we use to characterize many stigmatized ethnic minorities, like African Americans, for example. But notably, these terms are very similar to stereotypes used to describe Blacks in Britain or Turks in Germany, despite the fact that these groups have a separate culture and history. So again, it's really not about the qualities of the individual, it's about how we create a story that kind of makes us feel like the world is fair. All right, so here is my successful black man psychologist meme. And he says at the top, I hated the projects. And then at the bottom it says that I had to do for my doctoral program, but I confess they made me a better psychologist. Now, why is this funny? Most of you will identify that that this is humorous because when people see a black man there and he says, I hated the projects, they assume he's talking about like the ghetto that he clawed himself out of in order to be successful, and in reality that's not what he's talking about at all. And so it's funny because we know these stereotypes, right? We know that African Americans are often described in this way, and these stereotypes are embedded in the social fabric of our culture, and they frame our expectations. The problem is that pathological stereotypes like this lead to racism and discrimination, especially keeping in mind that, for example, African Americans are described with primarily pejorative stereotypes like lazy, ignorant, unintelligent, poor, criminal, loud, and hostile. Although there are also some seemingly positive terms as well, and I put the word positive in air quotes because all of these stereotypes are in fact harmful, but the positive ones include things like athletic, religious, and musical. Okay. And the problem is that stereotypes justify racism. And so pervasive pathological stereotypes suggest that disadvantaged groups are disadvantaged because they violate the Protestant work ethic by deviating from traditional values, like, for example, being criminal or lazy. Maintaining stereotypes about others then justifies the projection that it's their fault, and correspondingly, therefore, it can't be my fault, right? So here is a question I want to pose to all of you. Is racism still a problem today? And you can all click on that and vote, and we'll see what you think. So do you really think that there are actual, real, tangible disadvantages to being non-white?
Hi, everyone. So you should see the poll feature appear to the right of your screen. Please click either A or B, and we'll give that a few seconds. Dr. Williams, I will say that it's we're having a little trouble hearing you at times.
Okay. Let me try to move in a little closer to the mic so that you can hear me better. Thanks for letting me know. Is that better?
Yeah, that's perfect.
Okay, great.
Thank you.
All right. So far, most of you have said yes, that racism is still a problem today. Some of you were not sure, and we'll talk more about that, and hopefully by the time we get to the end of this, you'll have more certainty on that. Okay. So racism, well, first of all, it used to be very overt, and people would commonly, say racist things. They might even be part of social clubs that were overtly racist, and nowadays it's actually generally frowned on to be openly racist, and that's probably for the best. Nonetheless, we're still drenched in negative social messages about minorities that go way, way back, and again, these are those pathological stereotypes I mentioned before. And all of us absorb these messages and are influenced to some degree, and then as a result, it affects how we think and act. Now, although many of us mean well, we may commit racist acts unknowingly, and these behaviors are not functional in the sense that they don't translate into better relationships. Rather, they strain relationships and negatively impact others. Additionally, the research shows that there are actually some pretty serious mental health consequences of racism. And there's been a lot of new research in this area, particularly in the last 15 years, showing that discrimination is linked to stress, PTSD symptoms, serious psychological distress, depression, binge drinking, and then also several physiological problems as well that tend to be linked to mental health, such as hypertension. What research is uncovering, however, is that a strong positive ethnic minority identity is a potential protective factor against symptoms of anxiety and depression, unless the discriminatory events are severe, in which case, no amount of strong ethnic identity is going to protect a person from these negative outcomes. So there are several different types of racism. Most of us are familiar with what is often termed dominative racism or old-fashioned racism. That's the kind of racism where people are just very outward in their hatred toward people who are not like them. But more common than this are two other kinds of racism: symbolic racism, or also known as modern racism. And this is a type of racism where people embrace negative stereotypes about others and believe that they are morally superior or morally inferior to white people. So they may think black people are inferior to white people because they maybe say, oh, well, their values are messed up, or they don't care about their families, or things like this. And then there's aversive racism, which is unfortunately very common, and we often see aversive racism among people who claim to be very progressive and egalitarian, but they actually have negative feelings toward minorities, and often these negative feelings are unconscious. And we'll talk a little bit more about that as well. Now, given the different types of racism I've described, I have a little pop question for you. This isn't a poll, but I want you to think about what the answer is going to be. African Americans are least comfortable and productive and interacting and working with an A, old-fashioned racist, or B, aversive racist, or C, a non-racist. And I'll give you the answer to that in a minute, but first I want to give you a little interesting information. This is a research study that was done by a pair of social psychologists, DeVito and Gardner. They are always doing these sneaky experiments. I don't know if I could be a social psychologist, but some of the stuff they find is really interesting. And in this study, they wanted to have black and white people engage in a conversation, but before they did that, they assessed the explicit and implicit racial attitudes of the participants before they engaged in the interaction. And what they found was that white people who said they were not prejudiced thought they behaved in a friendly manner during the verbal interaction. For whites who turned out to be the aversive racists, in other words, they were low in explicit prejudice, in other words, they said they like everybody, but were actually high in implicit prejudice when measured with other means, what they found was that the blacks and whites had very divergent views about the quality of the interaction. So white participants, they believed they behaved in a friendly and non-prejudiced way, and that the interaction was positive and productive. But their black partners were like, yeah, no, not so much. They thought that the whites were less friendly than they thought they were, and the blacks were less satisfied with the interaction. And now what's the interesting thing about this, and this is that I think really quite applicable to a therapeutic situation, is that the black and white participants were unaware that the other person viewed the experience differently than they did. So the white person did not realize that the minority person thought it didn't go well, and the black person did not realize that the white person thought it went well. And so the two people were had very divergent views, and so this interaction was characterized by fundamental misunderstanding. Okay, and so that being said, I'm going to give you the answer to the question I put up earlier. African Americans are least comfortable and productive working and interacting with the aversive racists. And you might be wondering, well, why would that be worse than the old-fashioned racist, you know, the guy who is very open about his dislike for them. And the reason is that with the old-fashioned racist, you know what you're getting. With the aversive racist, it's very confusing, right? So they have found in experiments where blacks and whites have to work together toward a shared goal, working with the aversive racist is the most difficult. It takes the longest, there's the most confusion, and the job just takes a lot longer to get done. So this can lead to all sorts of problems in working relationships. All right. And so now I'm going to describe another form of racism, which is the main topic of our discussion today, microaggressions. These are small racist acts that are not clearly racially motivated, and they create uncertainty and anxiety in minorities. So a microaggression tends to be a brief, everyday exchange that sends a devaluing and potentially harmful message to a person simply because that person belongs to a minority group. And what's difficult about it is the target has to try to figure out what just happened there. And that ambiguity creates a sense of anxiety and distress as they are kind of coping to make sense out of the event. And so the stress from microaggressions may lie in the fact that may lie in the uncertainty that it involves. Okay. Now there's types of microaggressions. Sue put together a taxonomy of microaggressions in some various categories. We have the micro insult, which is an unintentional behavior or verbal comment that conveys rudeness or insensitivity. We have the micro assault, a blatant verbal, nonverbal, or environmental attack that is intentionally discriminatory or biased. And then we have the micro invalidation. This is a verbal comment or behavior that excludes, negates, or dismisses people's experiences, and this is often unconscious. And I have to be clear too, though, that microaggressions are not always statements. They can be actions, but either way they communicate a message. So take a look at this action and tell me what you think, right? We have Joe white man walking down the street. We have Joe black man walking down the street. Joe black man, he does not have a weapon. He is not wearing a hoodie. But for no apparent reason, Joe white man crosses the street. So what just happened there, right? And for a minute, I want you to think about the perspective of this guy. So imagine that you were going out in public in broad daylight, dressed nicely, and you noticed that people were often going out of their way to avoid you. What might you be feeling? What might you start to think about people like Joe white guy here? And what might you start to think about yourself? So it's really important to be able to put yourself in the place of the other, which I think you're all probably really good at as mental health professionals, to consider the impact that these behaviors might have on the target. Okay. And so the next question is, can well-meaning people commit racism? Can well-meaning professionals commit racism? Well, the tricky thing is that many microaggressions seem positive at face value. And as a result, there are many forms of microaggressions that can slip through and without the person who has aggressed even realizing it. They may actually think that they've said something nice or kind. And as a black woman myself, I'm often on the receiving end of these types of remarks. Although I know my friends and fellow psychologist colleagues mean well, the comments make me bristle inside. And so the point I want to make is that the person committing the microaggression may not realize how their comment has affected the minority person. All right, so I'm going to give you a few examples of microaggressions. And here is an illustration that is intended to be a hint as far as the question that I'm going to ask about how is this a microaggression, right? So in this scenario, the therapist says to the client, I don't see you as black. I just see you as a regular person. What message do you think the person on the other end of this is receiving when their therapist makes this comment, right? This comment tells the person that they are odd or irregular in some way due to their blackness. It's as if something is wrong with being a person of color, and the speaker is going above and beyond the call of duty to politely ignore inconvenient differences. The message that the client hears is, perhaps, you are abnormal, and I will politely ignore your abnormality. Similar statements may include statements like, there's only one race, the human race, which denies the individual as a culture or racial being. And statements like this often convey the message that the person is not willing to acknowledge the client's race. Okay, here's another one. Or offensive. In other words, I'm not a racist, you're just too sensitive. Okay, so what message do we imagine that the client hears in this case? We have a situation where a therapist has made a mistake and the client caught it and was actually empowered and brave enough to bring it up to the therapist. And what does the therapist do? Blame the victim and say, you are the problem, not me. And if you point out my racism, I will attack you. I can assure you that this is not going to lead to a good therapeutic alliance. Okay. Next one. The therapist says, if black people just worked harder, they could be successful like other people. All right. So this comment from the therapist shows an acceptance of the pathological stereotype that African Americans are just plain lazy. It also ignores the social forces such as institutional racism and other barriers that make it harder for minorities to be successful, right? So the therapist is essentially saying, people like you deserve to fail because you're lazy. So just go and roll up your sleeves and do some hard work like I do, and you will be just like me. Doesn't always work that way, right? Okay. Here is the next one. The therapist says to the client, did you grow up in the inner city? Now, given that as good therapists, we want to ask questions and not assume, especially, we don't want to assume stereotypical things about our clients, but this question contains an assumption that is a stereotypic one. It communicates to the client that you have preconceived notions about him or her. You could just ask, where did you grow up? But the way it's phrased, it's almost like, are you one of those people? And the message that the client might be hearing is, people from your ethnic group are all alike unless proven otherwise. And I believe stereotypes about you. Okay. Here's another one. This one's tricky. The therapist says, as a gay person, I know just what it's like to be discriminated against because of race. So what's happening here is the therapist is engaging in over-identification by denying or minimizing their own potential for bias because they're assuming there's a similarity there when there may not be. The therapist is saying your racial oppression is no different from my form of oppression, and therefore I can't be a racist because I'm just like you. I share your pain. Well, first of all, being gay is not the same as being Black or Hispanic or Asian, because all of those may be difficult for different reasons, but an LGBT person can often choose whether or not to disclose and to whom, whereas most minorities can't do that. They're, what you see is what you get. Furthermore, anyone can be a racist, even a sexual minority, even someone who's from a minority group, No one is immune to the negative social messages, in other words, the pathological stereotypes that disproportionately denigrate people of color. And so the message that your client may be getting is, my problems are just like yours, therefore I can't be a racist. And I think it's really important, before jumping in and talking about how much you understand and how much your problems are the same, is to really listen to your client first and let them talk and learn as much as you can, and then decide if there's something that's a point of similarity that maybe you could bond around if you want to self-disclose in some way. But don't jump in and make assumptions that your issues are the same as theirs. All right. Acceptance of undesirable behaviors. So this statement, so in this case, the therapist says, it might be okay for some people to cope by drinking alcohol because their cultural norms sanction this behavior. So what's wrong here, right? The message that the client may be hearing is, I expect people like you to be alcoholics, and so there's no point in helping you because that's just your cultural norm. It really shows a very perplexing, I think, acceptance of problematic behaviors based on that pathological stereotypes about certain minority groups. The client may actually be seeking help for an alcohol problem, and the therapist is not doing that client any favors by communicating approval of the behavior for any reason. So that's not cool. All right, here is another example. The therapist says, I'm sure you can cope with this problem as a strong Black woman. Now, although potentially flattering, I mean, who wouldn't want to be a strong Black woman? Well, if you're a Black woman, right? This form of idealization overestimates desirable qualities and underestimates limitations. A Black woman may be left feeling that she now has to live up to her therapist's expectations to be strong, and therefore she can't be free to share her weaknesses and vulnerabilities. In fact, the strong Black woman archetype keeps many of us who are Black women, myself included, doing things like working multiple jobs or overcommitted to family responsibilities and constantly in motion, resulting in problems like hypertension or binge eating disorder and no time for ourselves. And when we have no time for ourselves, therapy or medical care or self-care is the first thing to go. So the message the client might be hearing from this is, you don't need help, don't tell me about your struggles, because you're a strong Black woman. Okay, here is another example. The therapist says, you speak good English. Where are you from? To a non-white person with no accent. Okay, so this is a backhanded compliment that sends the message that the target is not a real American. Often Asian Americans and Latino Americans are assumed to be foreign-born, making such people feel as if they're aliens in their own homeland, like they don't belong here or anywhere. It may also communicate the belief that people from the person's group may lack proper education, refuse to assimilate, or are in the U.S. illegally. So the message that the client may be hearing here is, I don't think you belong. Okay. Now here's another one. Let's hope you weren't treated that way due to racism. So what's wrong with that statement? Well, this is a form of dismissal that fails to acknowledge the reality of racial discrimination as a problem in our society. It tells the other person that discussions of racism will not be heard, and racism is not a valid explanation for mistreatment. It may also communicate that the racist behaviors from others are actually the fault of the victim and not the person who perpetrated the act. So be very careful when you are drawing conclusions about what your clients are telling you, because the message that the client may be receiving from this is that the therapist is saying, your experience upsets me and I don't want to hear it, or maybe the problem is not racism, but just you, right? Mm-hmm. Okay, here's another example. The therapist says, I'm not sure we need to focus on race or culture to understand your depression. Okay, what could be wrong with this? First of all, I think this illustrates the clinician's own discomfort with the idea that racism and mental health are linked, but we know they are because I just showed you some of the data. Furthermore, how can the clinician possibly know if racism is the cause of the patient's mental health problem when he or she doesn't even take the time to listen and learn, right? The patient quickly discovers that this clinician will not take him or her seriously, and the message they might be hearing is, I know better than you, racism is not harmful, because obviously if you're depressed, it's got to be from something else. Believe me, racism can be depressing. Okay. All right, here's a tricky one. The therapist says, I don't usually do this, but I can waive your fees if you can't afford to pay. So what message does this send to your client, do you think? People like you are poor and need handouts? Yeah. This is an example of dysfunctional helping, which is patronizing to the client. It sends a message that the therapist believes the client and all members of their group are poor and in need of handouts. Now, certainly there are cases where fee reductions are helpful or even essential, but this should be based on income and not race, otherwise it's inappropriate. All right, so the first thing I have to tell you is all of those examples that I gave you, those were all real things that therapists have said. Yeah, sorry about that. A little embarrassing, but true. And these are the most common microaggressions committed by therapists in a study done by Constantine, where clients were asked to rate microaggressions they experienced from their therapist on a scale of 0 to 2. And what was found was, these were some of the most common microaggressions, and you can actually see that the number 1 microaggression was not an error of commission, but of omission, where therapists actually avoided discussing or addressing cultural issues in sessions. So in these cases, we had clients who were trying to talk to their therapist about difficulties or realities in their lives, and the therapist changed the subject or ignored it or moved on to something else. Other types of microaggressions include showing insensitivity about the client's cultural group or minimizing the importance of cultural issues in sessions or holding stereotypes. So these are all important things that you don't want to do because, in fact, research shows that microaggressions are negatively correlated to clients' satisfaction in counseling and also robustly negatively correlated to the therapeutic alliance. So, yes, I just said that. The nebulous nature of microaggressions may contribute to frustration and anger by clients. They're taking time out of their day, they're paying good money, and they are expecting that their therapist is going to be helpful and not hurtful. And then when it happens, minority clients may find it difficult to respond to racial microaggressions due to their own self-doubt and the power dynamics of being in the patient role. And so thus the harm that clinicians cause by microaggressions could be unknown or underestimated. So what do clients do when they are microaggressed against? Well, this is really tough because when someone experiences a microaggression, they may decide to do nothing, in other words, just sit on their anger. And this is often because they're sometimes unable to determine whether a microaggression actually occurred, be at a loss for how to respond, or be fearful of the consequences of what they might say or do, rationalize to themselves that it wouldn't do any good anyway, or engage in self-deception through denial. Oh, it didn't really happen. Responding with anger and striking back, which may be a normal and healthy reaction, is likely to engender negative consequences. And so as a result, the research shows that microaggressions result in a negative racial climate and self-doubt, frustration, and isolation in victims. Knowing that therapists feel free and competent to discuss racial and cultural issues in counseling may be liberating to many minorities because they may perceive the therapist as being comfortable with the topic. However, unfortunately, explorations of racial issues beyond a superficial level are still considered a taboo for some counselors, and many are, continue to be reluctant to bring up these issues. Okay. And also, I should point out that even among minority groups, people who experience microaggressions may bring up the issue with others in their group and just be told, hey, it happens to all of us, just move on and get over it, which can also be unhelpful. So I want to give an example of a couple of different types of multicultural daily life problems that clients may have and how therapists can encourage more functional behavior. And I'm going to kind of describe this using a functional analytic psychotherapy framework, which is a CBT relational type of therapy. So keep in mind that most minorities have already encountered discrimination in other contexts, and so they may be defensive when evaluating the safety of a new situation. And so you as a therapist want to acknowledge and validate mistrust, right? Don't take it personally. And you want to also maybe use this as an opportunity to ask about previous experiences with mental health or medical professionals in similar situations. So one problem we have here is we have a minority client who's coping with invalidating comments and fails to bring up feelings of being microaggressed to avoid conflict. And so perhaps a goal for this client, a small goal, would be able to express anger even toward the therapist for a microaggression if they feel that happened. And then a larger goal may be expressing thoughts and concerns about being misunderstood without allowing anger to take over. The client may have fear of being perceived in terms of negative stereotypes associated with race. And so the goal may be for them to and so they may avoid opening up or connecting intimately. And so a goal may be for them to start to open and voice their fears with the therapist. Racial minorities who've had adverse experiences or who have or may have mistrust toward white individuals may only engage in a superficial extent in therapy. And so maybe a goal for that client may be to allow themselves to open up and trust the therapist with difficult or intimate information. And then a larger goal would be expressing apprehension, stating potential problems, and opening up to the therapist with more intimate information. Okay. So likewise, quickly skip. Therapists may also have cultural problems in session. For example, the therapist may experience anxiety, agitation, and confusion in response to racially provocative material. And maybe the therapist's problem behavior is just referring those clients to somebody else of their same ethnic background. And maybe a better approach would be to openly express to the client that their feelings and also recognize their own potential bias or lack of understanding, and then take steps to educate themselves. Another therapist problem could be that discussing racial issues beyond a superficial level is taboo, and so the therapist may avoid topics about race or culture or redirect to a different topic when it's a culturally sensitive issue, whereas a more healthy goal may be to ask the client if their difference in race is something they'd be willing to discuss while recognizing that that might be uncomfortable. Another potential problem could be the therapist denying benefits experienced as a member of the white racial group because they've not really thought about this themselves. And they may deny or invalidate the client when the topic or problem arises. And so an important goal for the therapist could be acknowledging the unfair and unearned benefits of being a white ethnic member and validating the client if the topic arises. Other therapist problems could include feeling ashamed of his or her own ignorance on cultural topics, and then that leading to avoidance. And the goal for the therapist in that case could be expressing feelings openly and asking the client how and if they'd like to address the topic, and then again taking steps to learn more about the applicable cultural topics. Another problem could be a white therapist generalizing norms about racial minorities based on assumptions or statistics, and then making assumptions in session about the client's problems without allowing the client to explain the problems in their own words. And so a goal for the therapist in that situation would be to explore problems with an open mind and allow the client to express how he or she feels in the face of problems associated with race. It's also important to understand that the negative and denigrating stereotypes about minorities can also impact minority therapists as well who may struggle with some of these issues. For example, we may have a situation where a Latino therapist may feel shame about their cultural heritage and as a result end up being too deferential to white clients due to feelings of inferiority. And so a goal in that case for that therapist would be sharing their fears and being appropriately assertive in session. A problem another therapist may have, let's say we have a black female therapist and she's got dark skin and she may believe that fairer skinned black women are arrogant and want to be white. This is a problem called colorism that we sometimes see in the African American community, and as a result she may have hostility toward fair-skinned black female clients. And so a goal for her may be, instead of being hostile, just ask the client about their experiences as a fair-skinned black woman and recognize her own biases so she could work through them. So in terms of working with issues surrounding race and racism, raising the issue early in the relationship can convey cultural sensitivity and may address patient concerns about having a racially different clinician. It's really important that you as a therapist demonstrate a genuine interest and caring. So remember, your minority clients, they may have already had a lot of bad experiences, so they are maybe hyper aware to whether or not you get it, whether or not you are tuned in and paying attention to them. So demonstrate this by showing respect. And remember, for a lot of ethnic minority clients, respect is more important than rapport. You want to say things like, it's good to see you. Take time to listen. Ask the client to tell you more using open-ended questions. Okay. So it's important to keep in mind that microaggressions are common and they negatively impact everyone. There's no winners in this, okay? Stereotypes and aversive racism contribute to microaggressions. And so you may be asking, how do we eliminate microaggressions? And this task can be daunting. And so let's look at some ways to approach this. You are going to do your best and also expect to make some mistakes. I have made my share of mistakes. All right, so at the individual level, you want to reject pathological stereotypes, recognize and value cultural differences, be conscious to show care and respect toward people who are racially and ethnically different, make friends with those who are racially and ethnically different. That's a great way to learn about other people in a very real way. At work, speak out. You can combat some of these negative stereotypes by teaching about the accomplishments of people of color. Implement cultural competency in the learning environment and workplace, right? So, for example, coming to webinars like this, or even organizing something at where you work to keep the dialogue and the learning going on. Increase minority staff. So think about where you work. If most of the people who work there and who are in charge, they're all white people, well, that's going to cause some difficulties and lack of understanding and misperceptions. So you really want to do what you can to diversify your workplace. And then finally, public education campaigns, right? So getting accurate information out there in the community. All right, so I'm going to take some questions and answers now. You guys have been a great attentive audience, and yeah, I thank you for joining with us today. And I also have some recommended readings too that that you will receive a list of. Okay, so what are your questions?
Hi, Dr. Williams. So the first question that came in was really a point of clarification. So can you clarify your statements concerning microaggressions towards individuals who identify as part of an LGBT community?
Right. So when I talked about microaggressions, you know, this talk is really focused on racially and ethnically focused microaggressions, and I feel like microaggressions against LGBTQ individuals, that's like a whole another ball of wax, and I don't think I can do justice to both in one talk. So that was why the talk was focused on that one area. But certainly people, LGBTQ folks do experience a lot of microaggressions, and it's a big problem. And actually that's one of the things we're studying here at our Center for Mental Health Disparities is, you know, what those microaggressions look like and how can people be strong in the face of them. So does that answer the question, or was there another specific question?
No, I think that's great. Another question that came in was, can you speak more about the importance of respect versus rapport?
Yeah, that's a really great question, right? So as therapists, we put a lot of emphasis in our training and our work to develop rapport with people, and we have kind of an idea in our head of what that means. But in a lot of cultures, respect is more important than, you know, necessarily feeling comfortable or trusting or chummy with another person. They want to feel respected, and they want to respect you. And you're going to probably get a lot more mileage out of that when working with the person than perhaps relying on traditional methods that you've used in the past to establish rapport with your white clients. And so that's what I mean about that. So respect is a huge, huge issue in you know, most ethnic minority communities. And so you want to make sure that you're showing that.
Great, thank you. The next question that came in was, how would you address a supervisor treating you differently as a Black employee than your white counterparts?
That's a really tough question, right? Because oftentimes those differences in treatment are small or subtle, which, you know, puts them in that category of microaggressions, where you may even wonder sometimes, was that really, did that really just happen? Was that an act of racism? And I think in these cases, well, there's a couple of different possible approaches. One of the biggest problems is that when you often confront the person who's the aggressor, they very quickly become defensive. In our culture, nobody wants to be called a racist, and as soon as you tell somebody you think that they're doing something racist, their defenses go up. And as therapists, you know that you really can't get in any new or you know, curative information of somebody when they're on the defense, right? So I think it takes a little creativity to approach this. And what I've done in the past is sometimes I'll just tell stories. I'll tell my story, and I'll give examples of situations where I was aggressed against and talk about how it made me feel. And then once I feel like I have the person on board with that, then I might take that and connect it then to the situation at hand, and try to slowly, gently guide the person along to seeing what their behavior is and the impact of it. And you have to be willing to be a little open and vulnerable for this too. And it may blow up in your face, but this is a really, really tough. It's a really tough area to tackle. So that's what I'd suggest. And if the person is reasonable, I think you can usually make some progress. Of course, there's some people who just aren't reasonable, and in those cases, you may want to think about a healthier work environment for yourself.
Thank you so much. The next question is, how would you suggest we address secondary victims of microaggressions?
Secondary victims. What do you mean by that?
I'm not quite sure. I think if the person that posed the question can clarify it a little bit, we'll move on to another question and circle back.
Okay, right. Because I think as the victim of the microaggression being the one on the receiving end of it, and so I just need a little more clarification on who the secondary victim is in this example.
Sure. Another question is, can you speak more about microaggressions by people of color toward people from their own group or other minorities?
Right, right. So certainly, you know, I mean, as I mentioned, any person of any race can, you know, can behave badly, right? Can engage in racist behavior or microaggressions. And I mean, certainly if you have been to Los Angeles, you know that sometimes there's tensions between African Americans and Korean Americans. And you know, so really anybody who is not aware can perpetrate a microaggression against somebody else. And certainly you can also see it within a person's ethnic group, although I think that's a lot less common. But sometimes you do have people who may have poor self-esteem and feel ashamed of their ethnic group because they've digested all of these negative stereotypes and believe them, and they may feel very poor self-esteem, and so they may in fact even mock people in their own ethnic group or make fun of themselves. And I would say that this is definitely not a sign of strong mental health, but probably something that needs to be addressed and treated if the person's working with a therapist, because ideally they're going to feel the best when they have a very positive sense of ethnic and racial identity and pride.
Great, thank you. So we have time for just a few more. The next question is, do you believe that Black people can be racist?
Anybody can be racist, although I think in general, you know, this is a problem. This is a problem that kind of, you know, saturates our society. And when you consider the fact that, you know, we had slavery for 200 years and legalized segregation for another 100 years, and widespread discrimination ever since then, it's something that saturates our whole society. And so, yes, you can have you know, you can have minorities and you can have African Americans who are racist, but in general, though, the biggest problem is discrimination, because that's when someone is exhibiting a preference based on someone's race, and that person is in a position of power, and they have the power to withhold something that may be important or met out of punishment, and then that's where you really start to see inequities, and that's usually, again, coming from a person in a position of power. So it's much less likely that you're going to see, you know, say one Black person being racist in a way toward another Black person that actually results in discrimination and loss of something important. Although certainly that can happen. I mean, I'm, for example, an African American professor. I have graduate students. I could show preference to some students over the other, and that would be a discriminatory act because I am in a position of power over them. Although that's not usually the direction it goes, but it can.
Great, thank you. And I think this can be our final question. Any others we'll try to address after the webinar. But the question is, as a white therapist, how do you know when it is the right time in the beginning of the therapeutic relationship to bring up cultural, ethnic, racial, gender, or orientation differences?
That's a good question, and I think the earlier the better. Now sometimes this can be tricky because a lot of times minorities, you know, racial, ethnic, sexual minorities, they've, again, had so many negative experiences, they don't know if it's going to be safe to bring it up with their therapist, and they may be anxious or afraid. And so I think if you're a white therapist, you bringing it up can often take the burden off of them and reduce some of that fear and anxiety. And one way that I find that can make it a lot easier if you're not used to having these kinds of discussions is to maybe give the client some measures to complete that assess things like experiences with discrimination, ethnic identity, and other sorts of related sociocultural constructs. And then what you can do is the next time you see the person, you can say, hey, I was looking over this measure you filled out, the general ethnic discrimination scale, and you checked on here that you're having some stress at work due to racism. Can we talk about that? And then that can be a great segue into talking more about these issues and getting comfortable with it.
Great, thank you so much, Dr. Williams. Everyone, we just have a few more things to run through before the end of the webinar. So we have attached some recommended readings from Dr. Williams. All of our slides will be on our website within the next 24 hours, so please do check those out. We want to thank Dr. Williams so much. Thank you for your presentation. Thank you for your knowledge and your expertise. We really love having you.
Thank you.
And we want to thank all of you for joining us today. This is the third installment of our Race, Poverty, and Trauma series. We do have a link to the series for anyone that wants to check out the other webinars, one from Dr. Robert Carter, as well as another from Dr. Monica Williams that came before this one. And lastly, before you go, for those of you that are expecting continuing education unit credits, you will have to create a profile on the NYU social work site and follow these steps, then take the knowledge test. So you will receive an email with all of this information within the next 24 hours. Again, Dr. Williams, thank you so much for joining us. Thank you, everyone, for participating, and we hope that you have a great day.
It was a pleasure being here. Thank you.
Thanks. Goodbye, everyone.
Bye-bye.